Hi, my name is Angel Santos, and on behalf of AP Research, the following video will be presented. If you made it to this point, you've just taken a pre-survey given by your teacher or instructor, and both you and a parent have signed the participant consent form. Any results submitted that have not been given consent to use in this study will be immediately voided, no exceptions. Now, please pay close attention to the presentation as it may benefit you during the post-survey. Thank you, and let's begin. What are opioids? Opioid is a pharmaceutical term for pain-killing narcotics, synthetically produced from the dried latex in opium poppy plants. To the right of the slide is a diagram showing a poppy plant. The pod-like section of the plant is what holds the chemicals necessary to create opioid-related painkillers. Opioid receptors are the parts of the brain that react when opioids are consumed. In the bottom right is the density scale. Areas with red have a higher concentration and are the most affected when under the influence with opioids. As the color gets lighter, so does the density, or concentration. These receptors include the basal ganglia, cerebral cortex, the cerebellum, brainstem, amygdala, hippocampus, and the pre-Botzinger complex. The brain's reactions triggers the pain-killing sensation when opioids are consumed. How well it works varies on the dosage and which drug is taken. What is the opioid epidemic and why is it prevalent to know? The opioid epidemic has been a gradual issue from the 1990s and has been ongoing to this day. There has been a dramatic increase in opioid overdose deaths, and opioids are now responsible for 49,000 of the 72,000 drug overdose deaths within the U.S. itself as of 2017. Time magazine has had multiple issues covering this epidemic and is only one of many sources that have discussed it. Legal versus illegal opioids. Legal opioids include Vicodin, hydrocodone, codeine, forms of oxycodone, and morphine. Legal opioids are regulated by licensed physicians. However, the patient is still at risk to dependency. Illegal opioids include heroin and oxycodone. They are more at risk to being laced with fentanyl and has an even bigger risk of addiction. These were once used for medical purposes. That was before they were discovered to be highly addictive and dangerous to consume. It was made illegal in 1874 and remains to be illegal to sell, use, possess, or produce to this day. Why are some illegal and some are not if all are met with the risk of causing an addiction? All of which cause a pain-killing side effect. However, what makes illegal opioids more of a risk to take is because it is not in regulated doses like prescriptions are. It is also more likely to be laced with fentanyl, a synthetic opioid drug that is used as a potent analgesic or anesthetic adjuvant. Fentanyl is the most found compound during a medical examination for an overdose death. However, this does not invalidate the risk of taking legal forms of opioids. The following opioids are prescription opioids and their general usages. Morphine is an anesthetic used to sedate patients during surgery. Hydrocodone is used for around-the-clock treatment of severe pain. Oxycodone is primarily used for the treatment of moderate to severe pain, such as the pain that may be associated with surgery, injury, or chronic illness. However, it is abused for street usage and able to produce a euphoric high. Codeine is a narcotic pain medicine used for treating mild to moderate pain. Codeine may also be used to treat cough, diarrhea, and irritable bowel syndrome. In conclusion, all are prescribed to decrease pain in patients after major surgeries. The key point being that both prescription and illegal opioids have addictive risks for the person consuming the drug. Thank you for watching. If you have any questions or concerns, feel free to contact the researcher at the email attached to the participation consent forms or the researcher supervisor. We now ask you to continue on to the post-survey to complete and submit your results. Once that is complete, your part is over. Thank you again for your participation.